The Muskogee Creek Nation Department of Health, we asked the Southern Plains Tribal Health Board here in Oklahoma, which we are a part of, to conduct an epidemiological study for us. And so what they do is they go out and they pull data from federal, state, and local agencies, and then they take that data and come in and create this comprehensive look at all of that data, and they put that in the report. So when you look at the report, if you go online and look at the report, down at the bottom it will have a reference of which data source was used. So there's going to be multiple places where this information comes from, but we're very lucky to have somebody like the Southern Plains Tribal Health Board to partner with us on that, and so we're excited to be able to share this information with our citizens. What this community health profile is a snapshot of the 11 counties that make up the Muskogee Creek Nation, and also how that compares inside of the 11 counties with Indians versus non-Indians. And then it also compares the 11 counties to the rest of the state and how we compare overall to the state. So when in medicine, one of the things that you always want to have is data when you're trying to make decisions. Just trying to come up with stuff off your head is not the way that we should be doing business here. So as we develop this community health profile, what it really does is it gives us information about the breakdown of all of our specific trends. It gives us the demographics, it gives us the economic indicators, and it gives us also health indicators. Well, as we were looking through the data, one of the things that we already knew was that in comparison to the rest of the United States, Oklahoma already ranks at the bottom of many health indicators. Then when you start looking at the 11 counties inside of Oklahoma, Creek Nation has some really disturbing statistics that shows up in this community health profile. And we know many of them. We know things that we have higher rates of diabetes. We know that we have higher rates of heart disease and many of the issues that our citizens just deal with every day, and it's become part of our lives. But we've also started digging through this report and seeing that there were some things that were shocking. And one of the first things that we're going to address as we move forward with this is going to be our infant mortality rates. When you look at infant mortality rates in Oklahoma, it's some of the worst in the country. And then the Indian population inside of our 11 counties is even drastically worse than that. That means that if we want to grow our nation and we want to have a healthy citizenry, that we first got to address our babies are dying before they even have a chance to be born and live. So to me, this is one of the most important issues that I think that we have got to figure out is why is our babies dying? We instinctively know that our clinics, that in hospitals that we have, we don't have good prenatal care throughout our inside of our system. So we're going to start looking for partners who can come in and help us as we begin to grow prenatal care inside of our system, work with our partners in the Tulsa and Oklahoma City area regarding deliveries and how those babies, once they're born, how do they get back into our system, and we expand and grow our pediatric care. We know that this is something that's going to be absolutely essential moving forward. So with that, what we would really like to do is start to break this community health profile down, and every few weeks we're going to take a different topic that we find inside the report, and we want to go out and share with the nation. This is the numbers that we're seeing. This is the data that is showing us the problems with what our citizens are having as far as healthcare. And here's how we want to work with our citizens to try to change these numbers to make them better. And so we're excited to be able to do that. We're going to publish this report on the website, and then also as we roll out these weekly updates, we're going to also publish the report and have a place where our citizens can connect to it. One of the things I do want people to keep in mind is that when you look at data, it typically needs to be explained. And so that's what we hope that we're going to do as we go through these sessions, is to tell not only how is this data gathered, but also what does it mean, and then what should we be trying to do as a nation to address that problem. So I'm excited to be able to do this, and hopefully it's really going to have an impact on the health of our nation. So some of the topics that we're going to be addressing on a weekly basis is going to be addressing obesity. It's going to be addressing tobacco use and alcohol, injury and violence, immunizations and the importance of making sure that our citizens are immunized. It's going to talk about healthcare coverage and why is it important when you see us make a push to enroll people in Medicare and Medicaid and private insurance, and how that relates overall to the overall health of the tribe, and why is that important. We're going to do those sessions as well. We're going to talk about high cholesterol and high blood pressure, and how that's some of the things that we can do to make sure that our overall health is where it needs to be. We're going to talk about then the chronic problems with heart disease and diabetes and strokes and arthritis and all of those major diseases that we spend a lot of our resources on as a tribe trying to combat. Then we're going to get into some other areas that we haven't done so well in the past. We're going to talk about things like asthma, and because we have a lot of people that are in this area that are afflicted with asthma and allergy type conditions that we just have never really addressed here. We're going to get into a lot of the preventative screenings, such as why it's so important for us to get for our citizens to have mammograms and to have colonoscopies and all of the preventative care, and how by doing that preventative care, it really saves down the road when something does go wrong. And so we're going to talk about those topics as well. And then we're really going to spend a lot of time, I'm hoping, in this first session about maternal and child health. You're going to start hearing from our individual doctors, and we have some great doctors in the system that they're going to come out and address in these sessions about why having prenatal care is so important. And so you're going to hear from some of our female physicians that have taken this on as their mission inside our organization. And we have some really good doctors that are going to be able to address that. And I think that you're going to enjoy hearing from them.